Welcome to this YouTube channel. In this video we are going to talk about top 10 causes of diabetes. So before starting this video, like this video, and subscribe to our channel for further updates. Diabetes mellitus is a collection of disorders that impact your body's ability to use blood sugar, glucose. Because glucose is a significant source of energy for the cells that make up your muscles and tissues, it is essential to your health. It's also the primary source of energy for your brain. The underlying cause of diabetes differs depending on the kind. However, regardless of the type of diabetes you have, it can cause an excess of sugar in your blood. Blood sugar levels that are too high can cause major health concerns. Type 1 diabetes and type 2 diabetes are both chronic diabetic diseases. Prediabetes and gestational diabetes are two diabetes disorders that may be reversible. When your blood sugar levels are higher than normal, but not high enough to be categorized as diabetes, you have prediabetes. And, unless adequate actions are taken to prevent progression, prediabetes is frequently the forerunner to diabetes. Gestational diabetes develops throughout pregnancy, although it may go away once the baby is born. To comprehend diabetes, you must first comprehend how glucose is regularly handled in the human body. Insulin's mechanism of action. Insulin is a hormone produced by a gland below and beneath the stomach, pancreas. Insulin is released into the bloodstream by the pancreas. Insulin circulates in your body, allowing sugar to enter your cells. Insulin is a hormone that reduces the quantity of sugar in your blood. The amount of insulin secreted by your pancreas decreases as your blood sugar level drops. Number 10. The role of glucose. The cells that make up muscles and other tissues use glucose, a sugar, as a source of energy. Food and your liver are the two main sources of glucose. Sugar is taken into the bloodstream and, with the help of insulin, penetrates cells. The liver both stores and produces glucose. When your glucose levels are low, such as when you haven't eaten in a while, your liver breaks down stored glycogen into glucose to maintain a normal glucose level. Type 1 diabetes has a number of causes. Type 1 diabetes has an etiology that is unknown. What is known is that your immune system, which is generally responsible for fighting harmful bacteria and viruses, assaults and destroys your pancreas insulin-producing cells. You will have very little or no insulin as a result of this. Sugar builds up in your bloodstream instead of being delivered to your cells. Type 1 diabetes is assumed to be caused by a mix of genetic predisposition and environmental factors. However, the exact nature of those variables is unknown. Weight isn't thought to play a role in type 1 diabetes. Prediabetes and type 2 diabetes can be caused by a variety of factors. Your cells become resistant to the action of insulin in prediabetes, which can develop to type 2 diabetes and type 2 diabetes, and your pancreas is unable to create enough insulin to overcome this resistance. Sugar accumulates up in your bloodstream instead of going into your cells, where it is needed for energy. It's unclear why this happens, while genetic and environmental variables are thought to play a role in the development of type 2 diabetes. Although being overweight is significantly connected to the development of type 2 diabetes, not everyone who has the disease is obese. Number 9. Causes of gestational diabetes. The placenta generates hormones to keep your pregnancy going during pregnancy. Insulin resistance is increased in your cells as a result of these chemicals. Your pancreas normally reacts by producing enough additional insulin to overcome this resistance. However, your pancreas can't always keep up. When this happens, too little glucose enters your cells, while too much remains in your blood, causing gestational diabetes. Number 8. Overweight, obesity, and physical inactivity. If you are not physically active and are overweight or obese, you are more likely to acquire type 2 diabetes. Insulin resistance is common in persons with type 2 diabetes, and can be caused by excess weight. The distribution of body fat is also important. Insulin resistance, type 2 diabetes, and heart and blood vessel disease are all connected to excess abdominal fat. Check out these body mass index (BMI) charts to learn if your weight puts you at risk for type 2 diabetes. Number 7. Genes and family history. Certain genes, like those that cause type 1 diabetes, may make you more likely to acquire type 2 diabetes. The disease runs in families and is more common in the following racial ethnic groups: African Americans, Alaska Natives, American Indians, Asian Americans, Hispanics, Latinos, Native Hawaiians, Pacific Islanders. Genes can also increase a person's risk of type 2 diabetes, by making them more likely to become overweight or obese. Number 6. Insulin resistance. Insulin resistance is caused by hormones generated by the placenta, which occurs in all women during late pregnancy. Although most pregnant women are able to produce enough insulin to overcome insulin resistance, some are unable to do so. When the pancreas is unable to produce enough insulin, gestational diabetes develops. Extra weight is associated to gestational diabetes, just as it is with type 2 diabetes. When women who are overweight or obese become pregnant, they may already have insulin resistance. It's also possible that gaining too much weight during pregnancy is a role. Number 5. Photo of smiling pregnant woman. Gestational diabetes can be caused by hormonal changes, excess weight, or a family history of the disease. A woman's risk of developing gestational diabetes increases if she has a family history of diabetes, suggesting that genes play a role. Genes may also explain why African Americans, American Indians, Asians, and Hispanics, Latinas are more likely to have the condition. Number 4. Genetic mutations. Mutations or alterations in a single gene produce monogenic diabetes. These mutations are frequently passed down through families, although they can also occur on their own. The majority of these gene abnormalities result in diabetes, by impairing the pancreas' ability to produce insulin. Neonatal diabetes and young-onset diabetes are the two most common kinds of monogenic diabetes, MODY. Diabetes develops in the first 6 months of life. MODY is most commonly diagnosed during youth or early adulthood, however it can also be diagnosed later in life. Cystic fibrosis NIH external link causes thick mucus to build up in the pancreas, causing scarring. The pancreas may be unable to produce enough insulin as a result of the scarring. Hemochromatosis is a condition in which the body stores too much iron. Iron can build up in the pancreas and other organs if the condition is not treated. Number 3. Hormonal diseases. Specific hormonal illnesses cause the body to create excessive amounts of certain hormones, which can lead to insulin resistance and diabetes. When the body produces too much cortisol, also known as the stress hormone, Cushing's syndrome develops. When the body creates too much growth hormone, a condition known as acromegaly develops. When the thyroid gland generates too much thyroid hormone, hyperthyroidism develops. Number 2. Damage to or removal of the pancreas. Pancreatitis, pancreatic cancer, and trauma can all disrupt or impair beta cells' ability to create insulin, leading to diabetes. Diabetes will develop if the injured pancreas is removed due to the lack of beta cells. Number 1. Medicines. Certain drugs can sometimes injure beta cells or cause insulin to malfunction. These include the following. Niacin, vitamin B3, is a form of B3 vitamin. Diuretics, sometimes known as water pills, are a type of diuretic. Anti-seizure medication, psychiatric medications, antiviral medicines for the treatment of the human immunodeficiency virus, HIV/NIH external link. Pentamidine is a medication that is used to treat a certain type of pneumonia. Link to another site. Glucocorticoids, medicines used to treat inflammatory diseases such rheumatoid arthritis, asthma, lupus, and ulcerative colitis, according to the National Institutes of Health. Anti-rejection drugs are medications that prevent the body from rejecting a transplanted organ. Statins, which are medications that lower LDL, bad cholesterol levels, may increase your risk of developing diabetes by a small amount. Statins, on the other hand, can help you avoid heart disease and stroke. As a result, the numerous advantages of taking statins outweigh the tiny risk of developing diabetes. Consult your doctor if you have any concerns about the negative effects of any of these medications. What do you think about this video? Do let us know in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.